Thank you. I want to start by telling you about Judy Rose, whom I met last month in Dubuque, along with her husband, John. John lost his job of 30 years when the plant where he worked closed with just 1 day's notice. They lost their health insurance. Then in 2003, John had a heart attack. He spent hours in surgery and was in the intensive care unit. Fortunately, he survived. But when the bills came, their luck ran out. The cost of John's care was so high, they had to sell the home they'd lived in for 30 years. That is the tragedy at the heart of our healthcare system. The devastation when one stroke of bad luck undoes a lifetime of hard work. We can talk all we want about freedom and opportunity, about life, liberty, and the pursuit of happiness. But what does all that mean to a mother or father who can't take a sick child to the doctor? Today, as we strive for a new beginning to the 21st century, I believe everyone, every man, woman, and child, should have quality, affordable health care in America. Unfortunately, back in 1993 and 94, too many of our opponents adopted a strategy that amounted to just say no. I learned how important it is to present a plan that is clear and easy to understand. Today's plan is simpler, yet still bold. Now, I know my Republican opponents will try to equate health care for all Americans with government-run health care. Well, don't let them fool us again. My plan does not create a single new government department, agency, or bureaucracy. It is not a government takeover of health care. It is a public-private partnership that provides more choices. I call my plan the American Health Choices Plan. If you have private insurance you like, you can keep that insurance. If you like the doctor you have, you can keep seeing that doctor. If, however, you don't have health insurance, or you don't like the insurance you have, you can choose from the same wide variety of private plans that members of Congress choose from.
Hillary gets it.
I like the idea that the people that already have their doctors can keep their doctors, already have their insurance, they can keep their insurance, but she also included the uninsured that have a hard time getting insurance.
Hillary is compassionate, and that's going to be what makes her a great leader.
As I'm leaving college in a couple of years here, and I'm kind of going to have to be on my own as far as health insurance goes. And that's what's so comforting to know that Hillary will be in office, is that she'll be an advocate not only just for me, but for all other Americans who need health insurance.
Now, after 1994, when people asked me if I was going to give up on health care reform, I always had the same answer. Why would I give up on America and the American people? For so many years, I have listened to their stories. I carry these stories with me every day. And perhaps more than anyone else, I know just how hard this fight will be. But that is why I'm running for president. Today, we have an opportunity to make history together. As president, I will seize that opportunity, and I hope all of you will join me. Thank you, and God bless you.